Hi, this is Dr. Rogu from RVK Pediatrics. I'm coming here to you today with my student from NYCOM University, Isha Rao. She's a third-year medical student, and she had rotated with me for the past month learning about general pediatrics, and we decided to put together a little video presentation of why vaccines play a significant role in the well-care of children. So Dr. Rao will talk to you a little bit about all the vaccines and all the illnesses that we help to prevent, some illnesses that many physicians have not seen, and the younger physicians of today will probably never see because of successful immunizations. So Isha, if you want to take it over.
All right, thank you, Dr. Rogu. So as Dr. Rogu mentioned, today I'll be talking about the importance of vaccines and all the different diseases that they prevent. So why get vaccinated? The main reason to get vaccinated is to prevent some serious and sometimes fatal health outcomes from diseases that are not so prevalent right now due to the widespread administration of vaccinations. It also helps to protect the health of our community and prevents any disease outbreak. The table at the bottom of the screen shows the different types of vaccines and when they're administered in children from 2 years old and younger. So in the left-hand corner, you see some vaccines, and some of them we'll be talking about today. The first vaccine we'll discuss is the Dtop vaccine. This vaccine is a combination vaccine that protects against 3 different diseases: the D for diphtheria, T for tetanus, and P for pertussis. The vaccine is given 5 times in children at 2 months, 4 months, 6 months, 15 to 18 months, and then between 4 to 6 years. Another version of the vaccine called the Tdap vaccine is also given in children between 11 to 12 years, and then given every 10 years as a booster in adults to maintain immunity against these diseases. Some common side effects of the Dtop vaccine include vomiting, seizures, continuous crying for more than 3 hours, and a high fever. Diphtheria is the first disease that's covered by the Dtop vaccine. It's a bacterial infection that's spread via coughing and sneezing. It classically presents with a sore throat, a swollen neck, and mild fever. There's also a thick gray coating that forms in the back of the throat that is characteristic of diphtheria. Some complications of the disease include airway blockage, which makes it difficult to breathe, inflammation of the heart, damage of the nerves, paralysis, and kidney failure. Tetanus is a second disease that's covered by the Dtop vaccine. It is a bacterial infection that's spread when contaminated objects such as soil, dust, manure, and nails come in contact with breaks in the skin. Its classic presentation is a locked jaw and muscle stiffness, which makes it difficult to breathe and swallow. The chart at the bottom left shows the number of tetanus cases from 1947 to 2018. As you can see, the number of cases has significantly decreased, and today there are less than 30 cases per year, which can be credited to the vaccine. And most of those cases are usually in patients that either have not been vaccinated or have not been updated on their booster shots. Pertussis is the last disease that is covered by the Dtop vaccine. It's better known as whooping cough. It is a bacterial infection that is highly contagious and spread via respiratory droplets. There are 3 stages to this disease. It initially presents with common cold symptoms such as a runny nose, a fever, a cough, and then it progresses to a continuous, violent cough that can be associated with vomiting and exhaustion. Pertussis infection in children can cause a cough that lasts up to 3 months, and that's why it's classically known as the 100-day cough. Soon you'll see an example of what the cough sounds like. Some complications in pertussis include difficulty breathing, pneumonia, seizures, kidney disease, and possibly even death. The chart in the bottom right shows the success of the Dtop vaccine in decreasing the prevalence of pertussis. And Dr. Rogu, if you could play the video of the infant with a cough.
Sure, give me 1 second.
Okay.
All right, so we're going to see this little baby here that has whooping cough. That was the whoop right there. Hear the whoop?
Yes.
That baby looks pretty uncomfortable.
Mm-hmm.
So these children, when they were getting admitted to the hospital, they'd stay, they'll receive oxygen, and they could go out like this for a very, very long period of time. And the secondary complications, especially in the very, very small infants, are pretty dramatic. So I'm going to put you back to your lecture.
Okay.
Give me 1 second, I'll get you back to your lecture. Okay, take it away, Isha.
Okay, thank you. So the next disease that we'll talk about is polio. And polio is a viral infection that can spread either from person to person or through the fecal-oral route. It's a severely debilitating disease that was prevalent in the 1940s and 1950s before the vaccine was introduced. Polio is widely known for causing paralysis and losing the ability to walk properly, as you can see in the bottom left picture. This happens due to its effect on the brain and spinal cord. So the polio vaccine is given 4 times in children at 2 months, 4 months, between 6 to 18 months, and then again between 4 to 6 years of age. Today, the inactivated polio vaccine is exclusively used. However, an oral vaccine was available in the past, but it was found to be associated with risk of outbreaks and therefore is not used anymore in the United States. Polio, along with causing paralysis of the leg, it can also cause paralysis of the diaphragm, which makes it difficult for infected patients to breathe. Therefore, in the past, patients were placed in iron lungs, which you can see in the middle 2 pictures. And this was a device that helped the patients breathe by pushing air in and out of the lungs. And patients with severe cases of the disease had to rely on these iron lungs to stay alive.
So I guess that polio was an epidemic in the world. And
yes, it was.
Children were not going out to parks, to camps, to pools. People were afraid of bringing their kids together.
Mm-hmm.
Something to the way COVID is right now. Fortunately, they got the vaccine. You can see the picture at the bottom right-hand corner of the little sugar cube with polio for the little kid, and it helped a lot of people.
Yes, it did.
That's one disease that I have not seen in my entire career. Thank God.
Yeah, for sure. So rotavirus is the next disease that we'll talk about. This is a viral infection that's spread through contaminated feces, objects, or food. So the classic presentation of rotavirus is severe watery diarrhea that can be associated with vomiting, fever, abdominal pain, and dehydration. Before the vaccine was introduced, rotavirus was a leading cause of watery diarrhea in infants and children. Rotatec and Rotarix are the 2 vaccines that are available currently for rotavirus, and they're both oral vaccines. Rotatec is given in 3 doses at 2 months, 4 months, and 6 months. and Rotavirus is given in 2 doses at 2 months and 4 months. A rare side effect of the vaccine is intussusception, which is when the intestine telescopes into itself, which can block food from passing through. And usually it is treated with surgery.
The rotavirus used to cause a lot of children to get admitted to the hospital back in the day.
Mm-hmm.
Ever since we started giving the vaccines, children, they'll go to the doctor, we'll tell them they have a stomach virus, rehydration with PDLA, and children usually stay home. They don't get admitted as much as they used to. So I guess another successful vaccination story.
Yes, definitely. The next disease that we'll be talking about is H-flu. H-flu is a bacterial infection that is spread through respiratory transmission. The bacteria is normally found in our nose and throat, but it can cause infection if it moves to other parts of the body. Some present complications of H-flu include cellulitis, as you can see in the bottom left picture, epiglottitis, as you can see in the third picture, vasculitis, pneumonia, and possibly meningitis. The vaccine is given in 4 doses, one at 2 months, 4 months, 6 months, and then again between 12 to 15 months. Side effects of the vaccine are pretty mild. There can be some swelling, fever, and soreness, and sometimes, rarely, there can be vision changes and ear ringing associated with the vaccine. The next disease is Pneumococcal Disease, which is prevented with the Prevnar 13 vaccine. This is a bacterial infection that is spread via respiratory secretions. It can cause pneumonia, sinusitis, inflammation of the middle ear, and meningitis. The vaccine is given at 2 months, 4 months, 6 months, and then again from 12 to 15 months, similar to the H-flu vaccine. Some side effects of the vaccine include fatigue, loss of appetite, headache, and there is an increased risk for febrile seizures if given with the flu vaccine.
The good part of the Prevnar vaccine is, it was designed to prevent severe central nervous system infections. The secondary gain was it did reduce the amount of ear infections that children get. And it just goes to show, right now, during your rotations, how many ear infections did you see?
I've seen none so far.
I guess between the mask wearing and the vaccination in children, you haven't seen any ear infections, and that's
right.
It's good from from the healthcare point of view, but it's bad from the education point of view for you.
It's all right. I'll take that loss. So the bottom left chart that shows how much the number of cases have declined since the vaccine has become available. You can see there's a significant decline.
Right.
The Varicella Vaccine is the next vaccine we'll talk about, which prevents against chickenpox. Chickenpox is a highly contagious viral infection that results in a rash that looks like blisters in all different stages of development, as you can see in the bottom pictures. It is a rash that first appears on either the chest, back, and face, and then spreads over the entire body and lasts about 4 to 7 days. The vaccine is given in 2 doses, one from 12 to 15 months of age, and then 4 to 6 years of age. The Varicella vaccine is a live vaccine, therefore there is the chance that after vaccine administration, the patient can develop a slight rash, which is less severe than getting the disease itself. MMR is the next vaccine we'll cover, and this, like the Dtop vaccine, also prevents 3 different diseases: measles, mumps, and rubella. Measles is the first disease that we'll talk about. This presents with the classic cough, runny nose, conjunctivitis, and a rash. The rash in measles looks like a tiny, flat, red spots that are spread on the face and then continue downwards towards the trunk and limbs. Complications of measles include ear infections, diarrhea, pneumonia, and encephalitis.
Now, Isha, let me interject here a little bit about measles, since I can consider myself a measles expert.
Yes, tell your story.
Measles when I was an intern in 1996. I was working in the emergency room, and there was an outbreak. We were admitting children right and left with measles. They had high fevers, pneumonias, dehydration, and then one day I got it, passed out, and they admitted me. And I was sick in the hospital for about a week and a half, basically IV fluids. I couldn't breathe, had secondary bacterial pneumonia on top of it all. It was a mess. So I was of the generation that only had one measles vaccine. I wasn't required to get the booster.
Right.
Somehow it was on a transition time.
Mm-hmm.
That's why they give the booster, because it used to be thought that the measles was lifelong immunity. Then they discovered shortly afterwards that it was not. So that's why they give the booster. So it's not a disease, even though the children do very, very well with viral illnesses, adults, they don't do so well.
Mm-hmm. Yes. Thank you for sharing that. So mumps is the second disease that is covered by the MMR vaccine, and the classic presentation of mumps is a swollen jaw due to parotitis and puffy cheeks, as you can see in the image to the right. Some complications of mumps include orchitis, meningitis, pancreatitis, and deafness. Rubella is the third disease that is covered by the MMR vaccine, and it is also known as the German measles or the 3-day measles, because it is very similar to the way that measles presents. Rubella also causes a rash that starts on the face and spreads to the body, similar to measles, but it is less red and less contagious. It also can present with a low-grade fever, sore throat, and headache. The most important complication that is prevented with the MMR vaccine is congenital rubella syndrome, which can occur in mothers that are unvaccinated, and it can lead to birth defects in children, such as cataracts, cardiac defects, and deafness. The vaccine is given at 12 to 15 months of age, and then again between 4 to 6 years of age. Side effects of the vaccine include fever, soreness, febrile seizures, and bleeding disorder. However, pretty rare. The next vaccine we'll talk about is a vaccine that I'm sure a lot of us are familiar with, and it is the flu vaccine. So this prevents against the influenza virus, which is spread via respiratory transmission. It commonly presents with a fever, cough, runny nose, fatigue, headache, and body pains. Some complications of flu include pneumonia, inflammation of the heart, organ failure, and even possibly death in some cases. The vaccine is given yearly after 6 months of age and is associated with mild symptoms such as swelling, soreness, and fatigue. The reason that the flu vaccine is given yearly is because the immunity declines over time, and also the flu vaccine is constantly changing. The flu virus is constantly changing. So the vaccine is modified each year to fight the virus better. Next, I want to talk about the smallpox pandemic, which occurred thousands of years ago. And I think it is a great example of how vaccines prevent, and in this case, eradicate fatal diseases. So this is a viral infection that is spread via respiratory droplets and results in a rash, as you can see in the pictures below. During the smallpox pandemic, the virus had a mortality rate of 30%. It was pretty deadly. Thanks to the success of the vaccination, the last natural outbreak in the US was in 1949, and it was eradicated worldwide in 1980.
So that's not on our vaccine schedule anymore.
No, it's not, because it is not prevalent anymore. I would like to conclude this presentation by addressing a vaccine that is discussed quite frequently these days, which is the COVID vaccine. And I want to talk about the COVID vaccine specifically in relation to children. The clinical trials that were done previously did not include children. However, there are some trials going on right now that are studying the effects of vaccines in children. The current vaccines are approved for people older than 16 years old of those conditions can be found on the CDC website. I want to emphasize the importance of staying updated on children's well-care visits and their vaccinations during this pandemic, because they help prevent the diseases that we talked about in this presentation. So lastly, I would just like to end by encouraging you all to get immunized, because vaccines are one of the greatest discoveries in medicine, and it continues to advance as we see with the COVID vaccines. So I hope everyone gets immunized and stays safe. Thank you for listening.
Thank you, Isha, for this wonderful presentation. I hope you learned something. I'm sure our families from RBK will learn a lot from you. And, thank you for rotating with me at the office this month.
Thank you for having me.
No problem. Have a good night.
You too.